Hello and welcome to my channel. I am Pradesh Jadhav and today we shall be understanding a very common clinical symptom known as fever. But before we begin with this lecture, let's get to know a bit about the normal temperature and the definition of fever. The normal body temperature or temperature is a set point of the hypothalamic regulatory center which balances the excess heat production from metabolic activities of the muscles and the liver with the heat dissipation from the skin and the lungs to maintain a constant normal temperature of 37.2 degrees Celsius plus or minus 0.04 degrees Celsius or 98.2 degrees Fahrenheit plus or minus 0.07 Fahrenheit with the diurnal variation that is being lower in the mornings. Now we shall move on to the definition of fever. Fever is an elevation of the body temperature greater than 37.2 degrees Celsius in the morning or 37.7 degrees Celsius in the evening. It is in conjunction with an increase in the hypothalamic set point. Now we shall see a brief about the pathogenesis. The hypothalamic set point increases, causing a peripheral vasoconstriction, that is heat conservation. The patient starts feeling cold as a result of the blood shunting to the internal organs. The mechanism of heat production, example, shivering, increased hepatic thermogenesis to help raise the body temperature to a new set point. There is also an increase in the peripheral prostaglandins, more specifically in the prostaglandin E2, which accounts for the non-specific myalgias and arthralgias that often accompany fever. When the new set point is lowered again by the resolution or the treatment of fever, the processes of heat loss, example, peripheral vasoconstriction and sweating commence. This is also known as a remission. Now we shall be looking a bit into the etiology. Most fevers are associated with a self-limited infection, usually viral, and have causes that are easily identified. And now we shall look at how to approach a patient with fever. History, as they always say, is very important. A meticulous history is essential, with particular attention to the chronology of event. Example, in cases of rash, the site of onset, the direction, the rate of spread, and also other factors should be noted carefully. And also the relation to symptoms and medications, and also it should be seen that pet exposure, sick contact people, sexual contacts, travel history, trauma, and the presence of prosthetic materials is also noted down. A thorough physical examination should always be performed on a case of fever. A consistent site for taking temperature should be used. Temperature dissociations of pulses like a relative bradycardia should be noted if present. And sometimes it can be present in fevers with typhoid, brucellosis, leptospirosis, factitious fever. Close attention should be paid to any kind of rash with a precise definition to its salient features. Lesions should be noted with regards to their configuration, arrangement and distribution to the other body parts, and rashes that can be accompanying these lesions should be classified accordingly. Laboratory test. CBC with a differential, ESR and C-reactive protein should be done, and other tests can be performed as per the history and physical examination required. Treatment. The use of antipyretics is not contraindicated in common viral or bacterial infections, and they can relieve the symptoms without slowing the resolution of infections. Withholding of antipyretics may be useful. However, in evaluating the effectiveness of a particular antibiotic or in diagnosing conditions with temperature, pulse dissociations or relapsing fevers, example in cases of plasmodium like the malarial fever or Borrelia species. Treatment of fever in patients with pre-existing impairment of cardiac, pulmonary or CNS functions is recommended to reduce the oxygen demand. Aspirin, non-steroidal anti-inflammatory drugs, NSAIDs and glucocorticoids are particularly effective antipyretic agents. Acetaminophen is preferred because it does not mask the sign of inflammation, does not impair the platelet function and is not associated with Reye's syndrome, a uncommon side effect of other drugs. Hyperpyretic patients should be treated with cooling blankets in addition to the oral antipyretics. If you found this video informative, please consider liking and sharing it with your friends and colleagues. Thank you.